First of all, I'm very passionate about multidisciplinary care. I think patient-centered multidisciplinary care is the absolute right way to care for cancer patients. But when we look at how cancer care is evolving, it's getting more complex, number one. And so understanding who else needs to be at the table, who else needs to be part of the care team is important. It used to be that it was traditionally medical oncologist, radiation oncologist, surgical oncologist, maybe a navigator. Navigator being a very important piece of the puzzle. But now with, for example, immuno-oncology drugs, we've got and targeted therapies and mutational studies that need to be done and immuno-oncology. So now you've got toxicities we've never seen before, and we need the input from other specialists, for example, for the toxicities of immuno-oncology. Next-gen sequencing and targeted therapies, we need more help from the pathologist. Genetic counseling, because now we're identifying genes that can either influence treatment or can predict future risk of cancer and may alter the ultimate treatment plan of that patient. So as things get more complex, we need more people at the table. And then on top of that, as we're seeing more cancer survivors, we're seeing more of a demand for cancer care. We have a growing population in the 65 and older group, which is where cancer most frequently occurs, and concerns about workforce. We need to figure out how we're going to meet the needs of our patients. So whether it's more advanced providers, such as nurse practitioners or PAs, whether it's working with our primary care physicians to integrate them into the care team to help, and even educating, for example, going back to immuno-oncology and toxicity, educating our hospitalists, our emergency physicians to make sure they understand when a patient is on certain types of therapy, what needs to be done so the patient doesn't get misdiagnosed and mistreated. So there are so many drivers of that. So part of it was education and awareness. Part of it was about creativity and being open-minded to bringing different members of the care team in. It's really just thinking outside the box and not thinking in traditional senses and identifying the need, getting the appropriate stakeholders at the table, figuring out how to engage them, and then providing some platform so they can collaborate. I mean, those are really the key factors.